A very good evening, all. I'm Aditi Lamba, coming to you from a remote location in New York City. Welcome to the Tuesday night edition of Vision of Asia South Asian News segment. This is our ongoing report on the coronavirus pandemic, presenting to you South Asians on the front line and officials with information as well as updates on COVID-19. Again, we urge all our audience to continue practicing social distancing and stay safe and healthy inside. According to experts, social distancing is helping and will continue to help flatten this curve of spread of coronavirus. If you are on the front line serving the community, please email us on events@itvgo.com and share your experience and advice with South Asian Americans. Also reach us if you are a nonprofit contributing back and helping the ones in need. More updates now. Today, global coronavirus infections surpassed 2.5 million with US cases more than 800,000. This includes more than 170,000 deaths globally, with the United States at more than 43,000 deaths. Despite the growing number of these cases in the current pandemic, there are signs that the spread of the virus is slowing, with many countries exercising lockdown measures. Here in New York, Governor Cuomo said that when the state's economies are ready to reopen, the process will be coordinated regionally, while across the nation, some clusters of states have banded together to develop plans for reopening. States Georgia, Tennessee, South Carolina, and a few others today said that some businesses could reopen soon. Lots on the reopening of the country as hotspots like here in New York City continue to battle with coronavirus. We have tonight information on testing, updates, and advice featuring top South Asian medical experts, officials. So let's take a look at headlines. Pathologist Dr. Jaya on COVID-19 testing and updates, Columbia University Medical Center. Dr. Priya Mukhopadhyay on coronavirus pandemic, mental health awareness and impact. Interventional radiologist Dr. Sumeet Bahl on coronavirus pandemic updates, measures and advice. This and much more right after a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Aditi Lama and this is Vision of Asia, special report on coronavirus impact, measures and updates. Beginning the show tonight, let's take a look at our recent conversation with interventional radiologist Dr. Sumeet Bahl on information and developing updates regarding the coronavirus and its impact on the population. At the time of filming this, we are looking at more than 800,000 cases in the nation and more than 43,000 deaths. Giving his take on how we should understand and process these numbers, Dr. Bahl reflected on various attributes of the virus, treatments, and the current scenario of hospitals and the emergency room. Also, urging all to strictly practice social distancing, Dr. Sumeet Bahl also shared his personal experience during this pandemic and the impact on patient care. Here is Dr. Sumeet Bahl.
Could we perhaps reflect on the coronavirus itself right now? Because I think you bring up a really interesting point that now you're seeing complications that are arriving through the ICU. You're having to take care of patients beyond just what you were doing prior in the last couple of weeks. Could you reflect on some of the insights that you have found in this virus and the developments? Why is it so harmful to the lungs and the rest of the body? And if you are a high-risk patient, how high at risk does it put you?
So that's a good question. So I want to first clarify. I want to give all the credit to the emergency room physicians and the ICU doctors and everyone else involved who was trying to make that first line or front line, as we say, run. I came into the game, yes, early on because I was taking care of a certain set of patients who were coming through the door, but largely this is where we come in terms of the later complications, as you're asking about now. So I want to give a big shout out to all of them for their initial management of the wave. Now, what's going on with respect to how you were asking about how it's affecting the lungs? It's two major schools of thought in what was going on. Basically, what the virus has done is that when it enters the airway, it goes into the very small areas of the lungs where gas exchange occurs, basically where oxygen and CO2 are exchanged in the very small airways. And in that area, what it was doing is producing lots of basically inflammation and fluid buildup that was not allowing these patients to breathe well. And because their breathing was so impaired, that's why there was this whole move to put them on a ventilator very quickly.
Right.
As the disease, our understanding of the disease evolved, what we started noticing, it was not simply limited to just an airway problem, but it's also related to small, tiny little blood clots that are formed, what we think is related to the inflammatory response of the virus, where blood clots have formed and they're actually forming in the arteries that supply the lungs. So it's still an oxygen CO2 exchange problem, but it's kind of coming from the artery problem, not just the airways. So we've got a sort of mixed picture of patients. Some have one, some have the other, some have both, and that's what can make them very sick. So we're seeing both of them, and I really come in when it comes into the blood clot problem. That's where I really step in.
Wow. And in terms of testing and treatments, looking at the complications on all ends of this, from the frontliners to, now when you're coming in and you're seeing all these complications also develop, we are hearing everything from the anti-malarial drugs to blood plasma. We're talking about, antibody testings. Where do you really see some correct testing happening, in which we're actually able to test a lot more individuals, because they're saying that that's very key to reopening, testing and mitigation. So I would love you to, reflect upon that.
Sure. So with regard to testing, I think there's no one who would disagree that we need a lot more tests. I believe that the state who had the most tests was New York. We had over 500,000 tests, but the population is something around 19 million people. So 500,000 tests is a very tiny fraction of what we've been able to do as a hospital system overall in the entire state. And each state beyond that has far fewer tests than we actually need. The primary test that you've been hearing about is the one that tests for the actual presence of the virus. And so it's called a PCR. That's the type of test that was done. And it's the test that's most widely done now, where they basically take a swab, and it can go either in the back of your throat, or it can go in the back of your nose. Ideally, the better test is actually in the back of your nose, and that's the one that was being largely done. Now, what you're hearing a little bit more of is the antibody test, and the antibody test is not really FDA approved. There's one company out of North Carolina that has been FDA approved, but by and large, I think there's around 70 other companies who've kind of come forward, but there's nothing, and there's no at-home test or anything like that. So the antibody testing is sort of the new player in the game, but really it's the other original test, the PCR testing, that's been done. But it's still overall, whether you're looking at antibodies or PCR, it's still insufficient. And what we're trying to do is just bring it to scale as a nation overall.
How do you then perhaps look at the next week and the week after? We're looking at, the hotspots they're saying are still in the peak. So I'm, considering that New York is still in the peak right now as we're speaking. And from there, we're going to see a flattening of the curve, as everyone's talking about. Where are we in the next few weeks? If the testing, the vaccination are going to take time, the treatment is still, a conversation that we keep on having in the media. What should we expect?
So that's the magic question, right? Is what's the timeline going to be? And I as an interventional radiologist I can largely only go off of what I'm seeing in terms of complications, and I can go off of what I'm seeing in the news, just like you. I mean, in New York, our governor, Governor Cuomo, his last report was basically, we don't really know what the projection is. As you can notice, each state is kind of creating a measure for how long they think this is going to go on. You've got, and even country, right? India is looking at early May. New York is looking at May 15th. The President Trump is looking at for like May 1st or so. So everyone's sort of got different ranges for what we think the timeline is going to be. I would say that the most substantial thing, and this is not even just a physician, a healthcare worker factor, is really what all of you, everyone else is doing at home, is the continuation of social distancing and staying at home right now. That is going to be the primary determinant with respect to not only flattening the curve, but maintaining the flattening and actually bringing it down. The less people who are getting infected, the less of a spread, the less overwhelming of the hospital system, and therefore the sooner people can get back to work. It's largely dependent on not what we're doing in the hospital system, but what people are doing at home. I would say that's the primary determinant.
Earlier today, we spoke with pathologist and fellow research scientist at Columbia University Medical Center, Dr. Jaya Pradhan, on some recent updates and scaled-up testing on COVID-19 happening across the nation. A serological blood test which measures antibodies to the virus to determine who may develop immunity is the new public health tool that could speed the return to normal life here. At Columbia University Medical Center, a small group of physicians and scientists are working to urgently achieve the goal of finding the most optimized testing with accurate results for COVID-19. Providing much insight into the current ongoings of this testing, Dr. Jaya Pradhan also gave her strict advice on social distancing, her experience on the front line. Here is the conversation.
My first question to you would be, what are some of the unknowns right now in testing as we speak?
Yeah, so at this point, in terms of testing, what doctors can say is that even if we can test somebody right now and tell them that they have, antibodies against the coronavirus, what we cannot yet say for sure is what levels of the antibodies are required for the person to be protected from a second case of COVID-19. So we don't know how long people are safeguarded, and that's what we're working on now to determine.
Right. And, just again, looking at these cases currently as of, Tuesday, we have about 2.5 million cases globally. These are the stats that are coming in, 177,000 deaths globally. In the United States, we have nearly 800,000 cases as of today and over 42,000 deaths. Dr. Jaya, in terms of looking at these numbers and in terms of seeing the amount of, impact this, this disease has had, how should we be truly processing these numbers and also protecting ourselves?
Yes, so these numbers are sobering. These are scary, unusual times. And I think the most important message for the community at large and for our own South Asian community here is that we really need to follow the guidelines around physical distancing so that us in the medical community can defeat COVID in a systematic and effective way. And, physical distancing does not equate to social and emotional distancing. I encourage people to maintain their connections with their social networks through web-based platforms and social media outlets during these difficult times.
Definitely. So let's talk a little bit more about testing now. You are doing some amazing work in testing, and it is not the normal testing that we're hearing, which is just to test if somebody has COVID-19. Those testing locations and the testing we've heard everywhere about. Talk to me about what is happening at the Columbia University Medical School, and what is the specific testing that you are working on?
Yes, so on testing, there's two types of tests. So there's the diagnostic test for COVID-19, which identifies the presence of viral RNA and checks for active viral proteins within a sample. And that determines whether or not a person is currently sick and at risk of passing the virus to others. And then there's the antibody test that helps health experts better assess how many people have contracted the novel coronavirus, this test can help us get a better sense of how and where the virus has spread. It can also help us identify hotspots, allowing for increased testing and contact tracing in the hardest hit areas. And the goal for the coming days is to ramp up antibody testing from hundreds to thousands to 10,000 tests a day.
Antibody testing. So this is, again, something that we are hearing in national news everywhere. Can you exactly explain what exactly is happening in terms of antibody testing? And also, is this the way to truly reopen? As, again, reopening is a huge issue right now. We have states that are opening, as of this coming weekend. What do you have to tell us about antibody testing?
Yeah, so antibody testing is when a person has been exposed to the virus and their own body recognizes that pathogen and develops a response to that virus, so that if they're exposed again to that virus in the future, ideally the body would be able to tag the virus and fight it off in a more seamless manner. And so, if we can get accurate, reliable antibody testing out there, this will help the health experts better assess how many people have contracted the virus and, help guide public health officials, to phase reopening. The concern right now is that doctors cannot say for sure how long the levels of antibody actually stick around in the body, and really what level of antibodies is required for the person to be protected from getting, COVID again in the future. It is thought, however, that a higher initial titer, will take longer to wane.
So are you basically testing for immunity in these patients, patients that are not tested for COVID?
Yes. So we are what we're able to do with antibody testing is to check if somebody has been exposed to a virus and then developed an immunity to the virus. So they can, whether they're asymptomatic or symptomatic, if we have a reliable, accurate antibody test, we can, we would be able to assess that in the population.
And that is serology, exactly, that you're working on.
Yeah. So the primary means of checking for antibodies is through serology, which is through, looking at some, through getting blood or plasma from a patient and checking for antibodies in that. There are, other bodily secretions that have the presence of antibodies, but we're not yet sure if they'll have enough of a titer for us to make those conclusions. So, for example, saliva also can have certain antibodies present in it.
It's time for another short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Let's take a look at another segment of our conversation with psychiatrist Dr. Priya Mukhopadhyay on the psychological effects of COVID-19 as the number of cases continue to grow. We wanted to bring in a psychological perspective on ITV Gold as researchers are concerned about the mental health crisis quietly sweeping the nation alongside COVID-19, where they are expecting an overflow of mental illnesses that will emerge from a pandemic like this. Large-scale disasters are usually accompanied by an increase in anxiety, depression, trauma, and a broad range of other behavior disorders. Commenting on this and also her take on patient caring for individuals with mental health illnesses, here is Dr. Priya Mukhopadhyay on her experience on the front line and her advice for our audience.
Like I said, it's a very difficult time, and to cope with the numbers, especially if you're directly affected, is massive. But a lot of us are just, social distancing from home, and just seeing these numbers on the screen, it just it brings up panic. So I guess a lot of times I tell my patients to kind of stray away from the news. If it is like watching something like that is causing you to panic, you feel your heart racing, you feel like short of breath, and just, take a break, pause from the news. It's still going to happen. It's important to acknowledge that these numbers are there, that they're growing. But as long as you yourself and your loved ones are taking the measures to, be safe, then you shouldn't be affected.
Definitely. And, just looking at COVID-19 in general, what have you seen as the psychological effects, if I was to ask, in psychiatry and also in just, patient caring and treatment, with your new patient and old patients, what have you seen in the last couple of weeks?
Okay, so there's actually been a huge dynamic change in my field of mental health. Right now, I'm in the psychiatric emergency room, so I deal with crisis, like people in crises. So we actually have had less patients coming into the psychiatric emergency room in general. And by less patients, I mean a lot of times we get just simple agitation cases or like a little altercation at home. Those people have been staying at home, which I'm actually very happy about, because if you don't need to be at the hospital, even for psychiatric reasons, I would say hold off until later. We have instilled over the phone crisis hotlines, which we didn't have before, which we're seeing a lot of. We're getting a lot of phone calls. They actually plastered our number on the TVs and all around the town. So we're getting a lot influx of anxiety calls about people that have family members that are affected with COVID, and they're feeling the panic because their loved one, the only one that they're close to, is isolated in a room and they don't know what to do. They don't know how to maneuver around their house. So there's a lot of anxiety calls. There's a lot of people that are almost traumatized by this pandemic, and it's causing a lot of internal conflict, and we're seeing a lot of that too.
How do you see trauma as a result of this pandemic, just in the population in general?
Absolutely. Most of our cases right now are somehow related to COVID. Emotions as a result of the pandemic, trauma, like I mentioned, nightmares, loved ones, losing loved ones due to the pandemic, and more than anything, though, I'm talking with my coworkers. I think the influx of trauma and mental health cases after the pandemic, I guess, eases off is gonna be ridiculous. Like, we're expecting a huge influx of patients after all this is done, because you're kind of forced to stay at home, forced to deal with your feelings in the way that you deal with it. But once everything is open and you're able to come in, I feel like there's going to be an influx of patients.
And do you think most hospitals will be able to handle it?
Absolutely. Yeah. I mean, in the ideal world, we would have an unlimited amount of beds for inpatient hospitalization, an unlimited amount of appointments for outpatient visits. Unfortunately, it's not like that pre-pandemic, currently during the pandemic, and post-pandemic. But no patient goes ignored. If you're going to come for help, your needs will be addressed. So we're ready to handle it. We're always there. We've gotten more patients than we can hold in our emergency room, but we tackle it. So the mental health professionals will always be there. We're still there, even though everything else is shut down. We're still there.
Definitely. And Dr. Mukhopadhyay, while I have you here, the issue with mental illnesses, and how in the last couple of years we've addressed the fact that there is a mental health crisis in the country. So if someone is suffering from a mental health illness right now, say they are in treatment or they're taking medication, what are certain factors that, according to you, that they should sort of look out for? And do you consider them at high risk, perhaps, during this pandemic?
It's a very difficult time. It's tough, because a lot of people find their psychiatrists and their therapists as like the highlight of their month, the highlight of their week. It's a place for them to go. It's their safe place, and they're not able to have that. So I know a lot of people are struggling. And in terms of resources that are out there, I'd say to make use of everything that's there. Unfortunately, the help isn't as accessible as it used to be because of the lockdown. But a lot of people have had to make do with like self techniques and self relaxation activities. But I would say take advantage of your outpatient providers if you have one, as well as the crisis hotlines. If you feel like you need help, you need to talk to someone, you feel alone, don't be afraid to call and reach out. It's a phone call away. Our phones are working, thank God. So I would say make use of those resources. If you're on medications, do not ignore the fact that you're running out of medications. You are still able to get your medications. And if you don't feel safe going to the hospital, then you can call in and get those medications. We're doing assessments over the phone for people that are established patients or people that we can have some proof. And proof is easy to get. We call up the pharmacies, we call up their outpatient doctors. If you need a refill of medication and there is some proof, we'll give it to you. It's not, don't think it's impossible. People thought that this was impossible pre-pandemic, but we're making a lot of changes and tweaks just so that the things that are necessary are accessible to our mental health clients.
If you were to give out an appeal for donations of PPE to the local hospitals, and local areas, facilities, clinics. What would you say to our audience on donating this PPE and how essential it is for healthcare workers and medical professionals such as yourself?
PPE is literally the only thing we have protecting ourselves right now. If you do have access and you're not using it, then and you do want to donate, I would say reach out to your local hospital, reach out to a contact in a hospital, ask them what their PPE situation is. Would they mind getting a donation? Donations are always accepted. I've been extremely grateful and lucky that a lot of my supporters on Instagram have told me, listen, I have extra face shields. Can I send them to you? And I've distributed them within the psychiatry department. So, we have angels watching out for us everywhere, supporting us. A lot of the companies have been great. There's one in particular, one of the apps that help you with meditation and stuff. They're giving healthcare workers free subscriptions. So everybody has been very generous. They've been showing their support every day at 7 p.m. outside of my hospital. Everyone comes and claps. So I guess you guys as the public, you've been doing great. You've made us feel very appreciated, and you make us want to fight the fight even harder.
I know we're coming towards the close of the interview, but I have two more questions left here for you. Number one would be, with what's happening next? We're looking at coming to the peak. We're looking at flattening of the curve, and doctors spoken to us about it. What are some of your biggest unknowns right now that you need to sort of, tackle in the next couple of weeks?
Right. In terms of mental health, our unknown is, like I said before, what's it going to be like after? This is considered a period of trauma, I think, to many. And so I think there's going to be an emergence of a lot of PTSD, post-traumatic stress disorder from COVID, either due to a loss of a family member, being locked up in, households that are not favorable. A lot of children that are homeless in low socioeconomic status that, look to school as their like safe haven are not able to be there. So I know a lot of trauma will result, a lot of anxiety, a lot of depression now too, and coming out of that. Decompensation from lack of medication, lack of outpatient treatment on a scheduled basis. We're very scared that it's gonna be bad for the mental health field after everything gets better. And bad by meaning bad, I mean that a lot of people are going to be in crisis. Like I said, there's always going to be help available, so we're not worried about that. But I just feel like we're going to have to work very, very hard after this.
I think it's important for audience to actually know, facts like this.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from New York City. I am Aditi Lamba. This is Vision of Asia. Take care and be well.